We're here with Dr. Marty Frankel talking about the benefits of cosmetic dentistry. Marty, how are you this afternoon?
I'm doing really well. How about you?
Good, fine. Great to have you. This is a topic that I know many people think about, and they wonder what's right for them and what options are available, and everybody wants to put their best foot forward, or at least look their best when they're in relationships or in meetings with other folks, or just out doing what they do during the day. So I think what we'll learn from you today will be helpful to a lot of folks. Why don't you start by telling us a little bit about what's available in cosmetic dentistry today? I'm sure it's changed a lot in the last few years.
Oh, yeah. In the last, well, it's been around probably, the real cosmetic stuff that we're doing now has probably been around since the early 1980s. So it's now, 30 some odd years, and so lots has changed. When we first started doing cosmetic dentistry, everybody was talking about bonding, and it's the ability to actually get a dental material to stick to a tooth and stay there and not come off. It really revolutionized how we do dentistry, and as people started to become aware that dental work could not only work well but actually look really great at the same time, the dental manufacturers and the suppliers and the developers of dental materials really went to work and tried to come up with, and they've been pretty successful at it, beautiful looking materials that we could work with to make people's smiles look better.
And in all the years that you've been providing cosmetic dental solutions to some of your patients, what were some of the most common reasons that people wanted to do this?
Well, I think the most compelling reason for most people was that they were embarrassed about the way they looked. Some people have gaps between their teeth or discolored teeth. They may be yellow, or some people's teeth are sort of brownish. They have a lot of decay, and so the teeth have been broken down. But it all boils down to they're embarrassed to smile. They cover their mouths when they talk. They don't laugh as much as they would like to because they keep their lips together. And it's literally changed people's lives to be able to have teeth that look like real teeth and that function like real teeth, and when they talk and smile, you can see that they have beautiful teeth, and it's been a great thing.
What causes people's teeth to be like that? I mean, is it things they eat, or is it just heredity, or what are the things that you've learned over the years that cause teeth not to look their best?
It can be heredity. Some people's teeth, just the shapes of them are things that the shape of teeth is something you could inherit. Teeth that are maybe too small for your jaws, so you have big gaps between them, would be heredity. Even certain types of crowding could be heredity too. Crowding can also be caused by severe allergies. People who are mouth breathers develop, for lots of reasons, narrow dental arches, and so the teeth get kind of crowded in and collapsed in. And not only does that impact somebody's health, but also doesn't look very good. Discolorations, for years, a lot of communities have been putting fluoride in the drinking water, and there's fluoride in our toothpastes, and I'm a proponent of fluoride, but too much fluoride can cause tooth enamel to have a mottled, discolored appearance if you get too much before the teeth form. Once they form, it doesn't change, but in a developing tooth, if it can develop into something called fluorosis, and that can look not very good. Tooth decay, some people are just more susceptible to it, or they don't take very good care of their teeth, and and tooth decay can really eat away at teeth. One big one these days from abuse of certain drugs, especially methamphetamines, can really destroy people's teeth. And so
Okay.
all those things can lead to a bad appearance.
Well, let's go through some of the available options based on the kind of tooth conditions that exist, and why don't you tell us what you would recommend or what would be appropriate for various kinds of dental situations. Let's say somebody has teeth that are structurally sound and they're appropriately spaced, and there's not really any physical problems with them, but they're just either brown or yellow. They're just off-colored. What would be the best solution for that?
Well, the simplest way to take care of something like that would be tooth whitening. And tooth whitening is really good, especially for people with yellowish teeth, that they seem to respond the best to whitening solutions. Browns somewhat, grays somewhat, but yellow a lot. And so people who have yellow teeth can often do really well with tooth whitening. The other shades are a little bit more difficult to get to come up to a bright, nice white color. So for people like that, dental bonding, where we bond tooth-colored resin to the front surface of a tooth, can improve the color and the look of the teeth. And probably the kind of gold standard for cosmetic dentistry, which has been for many years, is porcelain veneers. And porcelain veneers are it is a veneer. It's just the front surface of the tooth that's covered with a thin layer of porcelain, and we can communicate to the lab and have that porcelain made in whatever shade we want, and they can be just beautiful sometimes.
And if someone has their teeth whitened or bleached, how long does that last? I mean, I had it done myself once, and I was just always worried about, the next time I drink a cup of coffee, they're going to go back to the color they were. Does that last at all?
Oh, it can. It really depends how it's done and whether you follow the full protocol. For example, when we first started whitening people's teeth, we used a take-home method. We'd make little trays, little plastic trays that would fit over their teeth, and they would put the whitening solutions in the tray. And often people would start to see a change in the color of their teeth within 2 or 3 days. But if they stopped at that point, the color would reverse really quickly. So typically you would have to do that for probably up to almost 2 weeks. And if you did it for the full 2 weeks, the color stability is much greater. I've seen people who have gone a year or 2, sometimes even 3, if they have a fairly clean diet before they do it again.
Okay.
For most people who like to drink a little bit of coffee or red wine or have a cigarette or something like that, which I'm not a big proponent of cigarettes, but I usually tell them to do a maintenance whitening with the tray at home, maybe once every 2 or 3 months, and that's just enough to kind of keep them at that lighter color. So as long as the person maintains it, they can last and last and last.
Okay, so let's go to the other end of the spectrum. What if someone came in and they had a lot of misshapen teeth, maybe a few missing ones? Their mouth was really not in good condition. Let's just say the jaw, the gum was okay, but the teeth were really just badly positioned, and a few were chipped and things of that nature. What would you do for someone in that kind of situation?
Yeah, so for somebody whose teeth are really not looking good, I would then resort to a restorative type of dental procedure like porcelain veneers or tooth-colored resin that we would bond to the teeth. And the difference between veneer and a resin is a veneer is what we call an indirect it's made in the lab and then sent back to us, and then we place it in the person's mouth. Resin materials that we work with are direct restoration, so we form them directly in a person's mouth, and so it takes less time. Also, usually a bit less of a cost to it as well, because we don't have to pay the lab when we do the direct restorations. Porcelain still lasts the longest. It retains its color and its texture and its beauty the longest of all the materials. The resins that we bond to teeth these days, they just look amazing, but they don't last as long from a color stability perspective. After maybe 5 to 10 years, they start to look not as good, and they have to be resurfaced.
So for someone who is thinking about, options for improving their smile, improving the look of their teeth, because they just want to start a new chapter in life, how would you advise they go about determining their best option?
Well, I think it's really important. I have a couple of stories I could tell you, but it's really important to be able to talk to your dentist and really communicate with them so they know exactly what it is that you want. Not what they think you should have, but what they really know what you want, so that they can give you the appropriate solution. For example, I just was talking to someone yesterday. She's become a patient of mine who, at her previous dentist, thought she was going in to have her teeth whitened and came away with bonded resin on her teeth. And the job that was done was not that great, and she's been extremely unhappy with it. And when I saw her yesterday, it was because of the way it had been done. It wasn't very kind to her gum tissue and all the other things. So it was kind of shocking to see. And had the dentist really listened to her, and also had the dentist communicated what they were going to do, the person would have. She was shocked when she finished. She had no idea that she was going to have this done, and so it was pretty bad. She said, where was I? Like, not me, her, but because she didn't realize what was happening, and so people have to take a really active role in communicating what they're looking for, and it'll be much easier to get what they want. So that to me is probably the biggest thing, is to be able to really talk to your dentist about it. Second thing is to be sure that a lot of dentists now, just about every dentist says they do cosmetic dentistry, and it's not that easy to do it well. And I think if a person really wants good quality cosmetic dentistry, that when people look at them, they have no idea that they've had dental work done, but they just look at them and say, "Wow, those are gorgeous teeth." You have to go to someone who really knows what they're doing.
And if for anybody who might be listening to this interview now, wants to learn more about how you approach this, how would you suggest they get a hold of you?
Well, we have a website that you can go to, and you can always people can always call our office and make an appointment to come in for a consultation to just explore some of their options. And the web address is... Sorry, go ahead.
No, I was going to say, I was waiting for you to give us the website address there.
Yeah, it's dtdental.com.
Okay. Well, Dr. Marty, this has been another very informative interview, chat on some of the things that people can do to improve their smile and presumably have a much more satisfying life after this. So I appreciate your time. We've been talking to Dr. Marty Frankel. This is Steve Smith. Have a great day.